Hello, everyone. This is Tamiris Cristhina from Brazil. I'm a professor here, and I'm with Joseph from Ghana. He's a PhD candidate, and I'm with Deepak Kumar from India, and we already have Dr. Marco Antonio with us as well in this paper. And this paper is the title is COVID-19 Policy Response in Brazil, Ghana, and India. Please go ahead, Deepak. So the policy response is essential to face complex situations, and we know that COVID-19 is a very challenging social problem. To face this social problem, this disease, we are watching governments to innovate, to cooperate, and to coordinate public policy in order to find policy solutions. Next slide. The objective of this paper is to analyze the COVID-19 situation, the policy response in Brazil, Ghana, and India. All of these countries are countries from the global south. And we analyzed the COVID-19 pandemic policy response in two categories. The first one is policy decisions based on scientific evidence. And we have this left side, the use of masks, the vaccine. These are scientific evidence policy decisions. So the governments that support this kind of measures are based on evidence, are based on scientific evidence. On the other hand, we have post-truth decisions, which means that governments that are supporting fake news, that are using extensively chloroquine, these are post-truth decisions, governments that are making lots of mistakes. Please go ahead. And we want to emphasize that policy response matters. If we get together, India, Brazil, and Ghana, we will see that now we have almost 1 million people that died in the last year and this year in these three countries. So the policy response of governments really matters. Next one. So now we analyze the policy response in Brazil. We emphasized not to do what governments cannot do. It's just watch what's going on in Brazil. So on June 17, we had almost 18 million people tested positive for COVID-19 in Brazil. The country already hit more than 500,000 deaths by coronavirus. And we are in the third place in the number of cases and deaths, according to Johns Hopkins. In the world, non-pharmaceutical interventions are being adopted worldwide. Lockdown emphasizing the social distance measure, scientific-based healthcare, government actions are being adopted. But in Brazil, medicines such as hydroxychloroquine, it's being largely promoted with little evidence. And we know that the post-truth and the negation of reality explanation why Brazil, that has one of the biggest health systems in the world and the vaccination, this immunization program that were a very example for the other countries, that explain why this country is failing. Please, next slide. So the COVID-19 post-truth effect has consequences in Brazil. So lack of policy coordination, the adhesion of population social measures are failing, and we have number of cases and deaths increasing day after day, and we have a totally ineffective policy response. And the president of Brazil, Mr. Bolsonaro, is an example of non-choice conflict because the governors and the mayors are imposing measures, lockdown measures, and the president is fighting against these measures. And the Supreme Court decided to give authority to the governors and the mayors that were trying to impose these lockdown measures. And we cannot conclude that the lack of policy coordination, the negationist perspective, the promotion of medicines not adequate to face the virus are some aspects that could be mentioned as factors that contributed to the worst phase of outbreak in Brazil. So go ahead, please. Now we have India. Deepak is with you.
Thank you so much, Tamiris. Now we are moving from Brazil to India. So, as far as India is concerned, on the contrary, India was doing very well in terms of first corona cases. Or, when in 2020 the outbreak came in India on first, it was on 27th of January 2020. At that period of time, it was literally going well. In the first wave of corona crisis, India managed really nice with little less number of deaths and cases. But when it come to second wave this year, 2021, the cases were very rampant. And if you can see on the slide itself, on 19th of June 2021, we have some more close to 298 million cases, which is now goes globally second highest number in terms of corona cases. And in respect of deaths, if you can see on the slide itself, it shows like some more close to 385,000 deaths, but now it has increased some more close to more than 401,000 cases of death as per John Hopkins report. On the first picture, the cases, if you can see, slightly increasing from you know zero to till today, and on the second side of the picture, you can see the deaths are increasing accordingly. So when it come to first wave, India managed really nice, but when it came to second wave, it was a more than a tsunami, where majority of authors and argumentative Indians talked on that. The active participation of all, like including government agencies, private agencies, NGOs, everyone was on the pace. But when it came to second wave, nobody was there. People were trying to hoard oxygen cylinders, concentrators, and the support from government was not coming as much as it was needed. At the same time, people were on the rampant on the road with health infrastructure crumbling here and there. Moving further, when it comes to COVID response policy, further, there were two things which came on the front. First was the management of movement of people, because India had one of the harshest lockdown announcement on very first itself in the world. At that point of time, it was only 4 hours given to many people who were working on the roads, and in those areas migrant laborers caught very heavily. And most of the time people were carrying their children, mothers were carrying children on their hands, somebody is carrying their children on their shoulder, and it was all massive brouhaha situation on the road. That was something which derailed the COVID management. And first wave, when it came to second wave, health infrastructure was crumbling, and different states, particularly down south in Kerala to western part of India, Maharashtra, it was trying to manage, but they could not. Similarly, when it comes to northern part of India, the Bimaru state, as we call it, like in India, the out-of-pocket expenditure was very, very high in terms of government paying very little amount, less than even a tenth of cents. Like when in terms of Indian rupee, if we talk about, not a rupee was paid by government. It was only people, they were presenting their whole amount of money. So one side people were getting poorer, at the same time facilities were not being given by the government. When it came to policy parameters in terms of vaccination, no one single policy was there. It was first time talked about central government is going to bear the entirely, but later on it was center and state government were shared, and later with the same share of private hospital also came. Nobody was knowing how to go ahead with that. People were paying again in terms of vaccination. But later on 21st of June 2021, government of India decided to have one set of policy on vaccination, and at that point of time it was very late. But now government of India's credit on that, we are leading numbers in terms of vaccination drive and becoming world's second largest vaccination people on the planet Earth. Moving further, there were also some positive sign when corona cases came in Wuhan, where the center of all corona things started. India was the one country which was leading from back to front, helping each and everyone, including more than 40 countries, bringing people and sending their respective countries. At the same time, when it came to first wave of corona cases, at that point of time we were sending most of the doses in terms of pharmacy, and the second wave we were soaked. But before that we already sent some more than 66.3 million doses to 95 plus countries. But when corona second wave came, we were rampant and we could not, so we stopped doing on that. And also we saved as many as 200,000 doses for UN peacekeeping mission. So on the contrary, we had suffering, but we had also a helping hand towards the major global nations. So now I'm handing over to my other fellow mate. Please go ahead.
So with the Ghanaian case moves a bit away from what has been described in Brazil and what has been described in India. Ghana has not had much of an impact, a dire impact of the COVID-19. I mean, in terms of the numbers, in terms of the death, among other things. Ghana's case of COVID-19, the government has done very well in implementing a number of policies that ensures that Ghana did not have a dire effect of COVID-19. And then we've grouped that into three major areas. The one aspect looking at health, the other looking at economy, and the other looking at social. So when it comes to the health, when COVID started, one policy that the government decided to adopt was to have an effective contact tracing. The 3T approach, where the government decided that it was going to contact trace anybody who comes into contact with the virus, and then when people are traced, they are tested, and when they are tested, they are isolated and then treated. That was a way to contain the virus in an enclosed situation. Again, what the government did was to give an insurance package and a tax relief to healthcare professionals so that will motivate them to give out their best in terms of providing healthcare to the people of Ghana. In the economy, the government thought it wise that most private sectors were now having an effect due to the COVID. So there was the private sector support by the government to ensure that organizations in the private sector are given the maximum support that they can have to sustain their works. In terms of social band, policies that were put in place by the government was, this ran across all countries, was to ban all public gatherings so that people will stay home. And with the saying that if people move, the virus moves. So if people are staying in their homes, then the virus can be contained. Religious activities were also banned. And again, the government thought it wise that since people had to wash their hands, and people had to use a lot of water to contain the virus, the government decided to provide free water for Ghanaians for more than 6 months. And then because people were staying home and using a lot of electricity, the government decided that it was going to subsidize the electricity bills for about 6 months. So as I'm saying, Ghana's government received a lot of praise, a lot of attention due to the management of the COVID-19. And you have Taylor and Berger in 2020 indicating that even the World Health Care Organization was studying some of the government of Ghana's techniques when it comes to COVID-19. And one of the key highlights again when it comes to COVID-19 fights in Ghana was that Ghana was the first country to be provided with over 600,000 doses of vaccines from the COVAX facility. I mean, this shows that the government of Ghana was very key when it comes to the COVID-19 fight, and was one of the key highlights when it comes to the COVID-19 fight. Um, so what the government of Ghana did was that the Ghana government, even though it is trying as much as possible to centralize to the minimum that they can. However, a lot of things are still centralized. So when COVID came, the government took advantage of that with the centralization, where the policy usually emanates from the president to make policy decisions, and then appointees of the government of the president will then have to make sure that the policy decisions that they are making trickle down to the people on the ground. So you have the government trying to take advantage of frequent periodic presidential addresses to make policies, and then the ministers will then have to be briefing people on how they are going to implement these policies. And then by way of communication, a dedicated website was set up by the government so that people will not be misinformed, will not be having information from different sources. A dedicated website was set up by the government to ensure that communication comes from one source. So to conclude, we've just to recap, we've presented how the governments of India, the government of Brazil, and then the government of Ghana have managed their COVID situations in Ghana. And if you see the slide, you see that there is one in green, there is one in yellow, and there is one in red. So with the green, we are trying to say that Ghana's case is a very good case study for countries as the COVID still lingers. Ghana's case is a very good case study for countries to continue to adapt. I mean, even with all the inequalities in Ghana, Ghana tried as much as possible to follow the scientific evidence of policy decisions to ensure that people participated, I mean, with policies coming from the central government. In India's case, India in the first phase followed all the scientific policies, but on the other hand, in the second phase was really attacked. So in India's case, we are saying India has a bit of both, where India followed full scientific in the first case, and then the post-truth in the second case. But the case of Brazil, the Brazil took the post-truth decisions without any scientific evidence. I mean, mainly coming from the federal government, spreading fake news without following scientific advice. So in Brazil's case, we say that the Brazil's case is in red to prevent to advise many countries not to follow the Brazil case. So in conclusion, we are saying that we've collaborated in sharing three different perspectives in policy responses, and then going from the scientific evidence policy decision case to a post-truth case based on fake news and a lack of scientific evidence. Thank you very much, everybody, for your kind attention.
Thank you.